Ulnar nerve is on the medial side, is how I prefer to look at it. I prefer to start looking at it in short axis. So it runs between the olecranon and the medial epicondyle, it's a space you can definitely palpate, not too hard, otherwise you'll hit their funny bone. But it sits right against the medial epicondyle. It should be fairly small, bright epineurium around it and dark inside. Mostly when we're looking at nerves, we don't like to see dark, but it is totally normal for the ulnar nerve to look dark here. First, we want to see if it's going to subluxate or pop over that medial epicondyle. It's important to not have too much pressure, so really just kind of balance the probe there. Most of the pressure should be on your guide fingers. So go ahead and flex your elbow. All the way. Good. And go ahead and come back out. So we're watching that nerve to see if it pops over the top of the olecranon or even subluxates fully out. In this patient, it does not. It doesn't always have to be symptomatic. It maybe is not at all. We see this often in patients who aren't symptomatic, but it's always important to check. Then we can follow that nerve in short axis across the joint line and in between the two heads of the flexor tendon, one of the two heads of the flexor carpi ulnaris. Between here and the olecranon is often when we start to see pathology. It'll be thick and hypoechoic, more so than we would expect. Now we're going to turn in long axis to see if there's a dumbbell shape that may indicate impingement. So I'm going to put the nerve in the middle of the screen. This is where I prefer to turn long on it. I find it harder to turn long on it at the bend of the elbow. There we go. And now it's in the middle of my screen. I'm going to follow it up. And it stays nice and homogeneous in thickness all the way. This is where I would probably take a picture just to prove that it's normal, but it looks good. Very good.